Hello everyone, welcome to Yale. Thank you for attending this session. My name is Chen Liu, and I'm the Chair and the Chief of the Department of Pathology for both the Yale School of Medicine and Yale New Haven Hospital. Today, you will gain insights into our pathology training program, our department, the school, and our New Haven communities. We pride ourselves on our long-standing tradition of training the next generation of pathologists and scientists. Doctors Brian Smith, Andre Barberi, and I myself, along with our exceptional team of faculty and staff, to ensure you have the best experience at Yale. Established in 1867, Yale Pathology is a place for creation and dissemination of knowledge. Our commitment to excellence, both clinically and academically, is intrinsic to our department's mission and to our aspiration of enhancing patient care via masterful diagnostics and innovative therapies. Many of our clinical faculty members are globally and nationally recognized experts across various subspecialties of pathology. Our basic science and physician scientists faculty members are at the top of their field, such as cancer biology, aging research, genomics, epigenomics, immunology, infectious diseases, and cell therapies. We are offered numerous subspecialty fellowships. Embracing the principle of tailored training, we strive to amplify your strengths and champion your passions. Pathology is a dynamic and evolving medical field. It employs state-of-the-art technologies such as molecular biology, digital pathology, and artificial intelligence to deliver precise diagnosis to patients. Additionally, pathology plays a key role in novel biomarker discovery and therapeutic development. Direct patient interaction, community engagement, and global health initiatives are becoming part of our practices. We have established several such programs within our department. At Yale Pathology, you will have access to all these resources to enrich your training and align with your career aspirations. Finally, I would like to underscore the point that as a resident, you are not merely a student. You are an invaluable member of our patient care team. Together with our faculty and staff, you will contribute to patient care and the discovery of new knowledge. I hope you will consider joining us. I wish you the very best in your residency application process.
Hi, welcome to Yale. My name is Brian Smith. I'm the Chair Chief of Laboratory Medicine, both at the Yale School of Medicine and at Yale New Haven Hospital. You're going to hear a lot today about our pathology training programs and also a lot about graduate medical education in general, and why we are so happy to be here in New Haven and at Yale, and looking forward to training many of you in pathology as time goes by. You know, Yale has always been a place that really tries hard to work across academic barriers, across healthcare barriers, across the entire university and across the entire health system. And I think that deeply held part of our culture is ingrained in our training programs as well. It's frankly one of the things that brought me here, now it's over 30 years, and has kept me and my family here in Yale and New Haven, and it's really been terrific for us, I think terrific for our trainees, and a wonderful opportunity for all of us here. I'm not surprisingly perhaps, I have a lot of opportunity to travel around the country. I get to see a lot of different academic medical centers. I always take the opportunity to try to meet with and talk with the pathology trainees at all of those different places. And when I do, and they're wonderful places and they're wonderful trainees, I'm also always reflecting and always impressed by our own faculty here, our own trainees here, particularly in terms of how well known all of our pathology trainees are, not only by other house staff members across the various disciplines, but also by the faculty clinicians, whether it's in surgery or medicine or pediatrics or the emergency room. They really are well known. You may get, as a resident here, you may get stopped in the hallway by any number of folks who you know, asked about, should you get a biopsy or an FNA on this patient? How do I interpret this clinical laboratory test in the context of what's going on in my patient here? What's the best way to do transfusions in somebody who has refractory thrombocytopenia? We really see in our training and how we look at the world, and I think all of our colleagues here see it the same way, we see the pathologist as a critical, central member of the team taking care of the patient, whether it's in the initial diagnosis, where the pathologist is often the key individual in the team who is making the diagnosis, but all the way through the entire treatment course of a patient, whether in hospital or out of the hospital. And I think it reflects really our philosophy here of teaching, and also teaching a little bit to the future as well. As you're well aware, pathology is really having an amazing advancement here over the last 10 years, 15 years, and we are looking forward to years and decades of further advancement. And you need to understand not just how we diagnose disease today, not just how we treat our patients today from a pathology perspective, but also how we're going to be doing it 5 years from now and 10 years from now. So we spend a lot of our time trying to make sure that that happens in your training program as well. So I just want to once again welcome you here, and we look forward to potentially seeing you with us for a long period of time after your training here. Take care now.
Hi, everyone. My name is Andrea Barbieri, and I'm the Residency Program Director here at Yale Pathology. It's really my great pleasure to welcome you to our Residency Program Interview Day. In this overview of our program, I'd like to impart upon you some important information so you can learn more about who we are, how we train, and how we live here at Yale Pathology and Laboratory Medicine. At Yale, residency is built from two nationally recognized departments: pathology, led by Dr. Chen Liu, and laboratory medicine, led by Dr. Brian Smith. Focus on anatomic and clinical pathology in two departments has allowed for excellence in both areas that is a staple of our training program. Their commitment to excellence and innovation and vision for trainees as partners in the provision of healthcare provides the foundation for our training environment and helps us make decisions about how we lead our program. Our program is supported by a dedicated and active leadership team composed of myself, Dr. Rita Abirad, Aaron Horstman, and Harv Ringer that work closely together and with trainees and leadership. Most of us have training experiences within the program, and this gives us direct knowledge of the training experience here. In addition, we have expertise across anatomic and clinical pathology, as well as in education. Our current house staff includes MDs, MD PhDs, and DOs. Our residents come from more than 20 states and 5 countries and train across multiple tracks. That includes AP-CP, AP-only, CP-only, and AP-NP. We have nearly equal split of gender represented within the program, and these diverse perspectives and interests really strengthens our training program culture and environment. Our overarching philosophy is that trainees are our partners in the delivery of healthcare. Our culture values excellence across our tripartite mission in education, research, and clinical care. Ultimately, this translates to high expectations that develop unparalleled diagnostic skill acquisition in our trainees. And we know that this can't happen in a vacuum, and we balance this with a high level of support. Our program is dynamic and shaped with resident input through monthly house staff meetings, a class representative structure, and other feedback mechanisms. Residents are paired with faculty mentors when they enter our training program, Each rotation has an education leader that centralizes resident education on that clinical service, and the Office of Education supports residents in all logistical aspects of their training. In addition, there's robust PA support through teamwork in areas like the gross room and on the autopsy service. As a leader, a core value of mine and a standard I hold myself to and expect of our trainees as well is high integrity and accountability. I also believe that trainees experiencing joy in the practice of pathology is integral for their well-being and their career longevity in pathology. So our curricular content, program structure, and resources are really viewed through that lens. Our primary training site is located in downtown New Haven. The Department of Pathology is located on the second floor of Yale New Haven Hospital. The laboratory medicine tower is 1 block away and accessible within a 5-minute walk. That's inside or outside. Smilow Cancer Center, a National Cancer Institute, sits between them and provides rich material for education and research in our program. The Yale School of Medicine is within a 5-minute walk as well, and this allows our trainees access to one of the very best medical historical libraries in the country and opportunities for our residents to teach medical students. Beyond our primary New Haven training site, 3 additional training sites support exposure to diverse cases and training environments. During PGY 1 year, residents rotate for 2 weeks at the Connecticut Office of the Chief Medical Examiner in Farmington, Connecticut, which is about a 45-minute drive away. We do our best to custom build a schedule that pairs trainees to limit transportation barriers. During PGY 1 and PGY 3 years, residents rotate at the VA Connecticut and AP and CP. This is a 10-minute free shuttle ride from the School of Medicine. During PGY 4 year, residents rotate in a community setting at Bridgeport Hospital, which is about 25 minutes away via car or train. Across 4 years, you'll rotate through a tailored mix of anatomic and clinical pathology with elective time added to second year, so you can sample nearly all subspecialties during your first 2 years of training. PGY 3 is a dedicated year within laboratory medicine. PGY 4 year is used to focus your training in areas of interest with more elective time and graduated responsibility. As you can see, in the first 2 years, there is a lot of AP focus, but we intentionally added 8 weeks of CP rotations to provide early exposure. A custom schedule is built to prevent vacation from interrupting 4 rotations each year. Our program benefits from a high volume and high complexity case mix that's really fantastic for resident training. We have more than 50,000 surgical pathology specimens annually and 65,000 cytology specimens annually. This doesn't include external consults that we also get and are often really wonderful for training. These are from our Smilow Cancer Center, and these help ensure broad exposure and deep diagnostic experience for our trainees. We have over 50 nationally recognized faculty. These include subspecialty attendings that chair committees, write guidelines, and headline international meetings. They interact with residents on a daily basis and provide supervision and feedback. So ultimately, when you come here to train from us, you're learning from the best. And we really prioritize the direct time that residents spend with the faculty, as you can see here in the image, what a sign-out looks like. Workflow is optimized for learning through robust PA coverage and an autonomous autopsy team that keep resident experience focused even when there's changes in volume. And we use technology to strengthen learning within our program. Whole slide scanners support clinical work, research, and education. Whole slides are accessed for tumor board presentations, prior case reviews on service, unknown case conferences, and by searching our case archives when residents want to find an interesting or unusual case. We have a 1-day cycle for grossing rotations, and this encompasses 30% of the time spent during PGY 1 year and 45% of the time spent during your PGY 2 year. Each day begins with a didactic or case conference or an unknown slide seminar, and mid-morning sign-out pairs you with faculty directly for up to 3 hours of direct face-to-face sign-out with immediate formative feedback on all the cases that you've prepared for that day. Afternoon grossing is done with skill adjustment for PGY1 and PGY2 levels in collaboration with PAs who are also assigned to each of the services that residents are rotating on. The evening is then used for preview of cases for the following day, and these are previewing of the cases that have been previously grossed, so you get to follow those cases closely to resolution. Our subspecialty schedule is done in block rotations with experiences that usually last 2 or 4 weeks. So you can see an example of our block schedule here. For PGY1 residents this year, they completed 4 weeks of boot camp, followed by rotations where they're going on. So hematopathology here for 2 weeks, and then clinical pathology heme flow to complement that. You can see how subspecialized we are. Residents rotate on gyne, thoracic, endocrine, head and neck, genitourinary, A is autopsy, and breast resection.
My name is Erin Orstman. I'm one of the associate program directors, and I primarily oversee clinical pathology training for our residents. Our clinical pathology training takes place within the Department of Laboratory Medicine, where residents rotate through our clinical labs, including microbiology, virology, chemistry, immunology, hematology, and flow cytometry. Residents also have rotations at the West Haven VA, where they are able to experience general clinical pathology sign-out and workflow. Rotation through all of these different labs gives residents experience at interpreting both routine and specialized testing, and our residents also act as expert consultants to our clinical teams in guiding appropriate workups for patients. Training in these large state-of-the-art labs exposes residents to a very high specimen volume and a very broad test menu. Yale New Haven Hospital serves as a reference lab for many of the smaller hospitals in the area, which further allows us to see testing that is performed in a diverse patient population, as well as both adult and pediatric populations. A typical day in clinical pathology starts at 8 a.m. Residents will receive handoff from the resident who was on call overnight and follow up on any urgent cases. And then from 8:30 to 9:30, attend a didactic lecture or case conference. At 9:30, all of the residents return to their rotation, and their responsibilities vary based on the specialty that they are rotating in. In clinical chemistry, residents interpret chemistry and immunology testing, screen high-cost send-out testing, and work very closely with our lab managers and lab administration to learn about lab management, including quality assessment and test validation processes. On the heme flow rotation, our residents review peripheral blood smears and body fluids and interpret coagulation testing, hemoglobin electrophoresis, molecular testing, and flow cytometry. When residents are on transfusion medicine, they participate in the workup of complex antibody studies, transfusion reactions, and platelet refractoriness, and reach out frequently to clinical services regarding not only this testing, but any other important blood bank testing affecting patient care. There's also the opportunity to participate in the care of our apheresis patients, including patients who are undergoing red cell exchange, therapeutic plasma exchange, and collections for cell therapy, including stem cell collections and CAR T collections. Microbiology is a busy service where residents provide guidance and interpretation of testing to clinical teams in the areas of virology, bacteriology, parasitology, and mycology. They participate in state-of-the-art pathogen identification testing and susceptibility testing and work very closely with our infectious disease colleagues. Finally, the West Haven VA is our general clinical pathology rotation, where residents provide test interpretation and consultation to clinicians throughout the hospital on testing performed in all areas of the clinical lab. At 5 p.m., residents from all services hand off to the resident who is on call overnight, and this resident will be covering all of the services and any urgent calls that happen overnight until 8 a.m. the next morning. Our clinical pathology rotations are very busy, but very educational and rewarding for all of our residents.
It's been shown that the length of onboarding and boot camp relate to how well trainees are prepared for and perform as they begin their residency training. One of the ways we support our residents from day one is by starting with a 4-week boot camp in the areas of autopsy, surgical sign-out, gross room, and lab medicine. You'll observe and learn the basic workflow of the department during this time and attend high-yield didactics in normal histology in all areas of subspecialty pathology. Following boot camp, you're ready to hit the ground running for your first real rotation. We also support a peer mentorship model where you're paired with a PGY2 during your first 2 weeks on a major search path rotation. So what are our outcomes of our training philosophy? Our trainees go on to complete diverse fellowships in the area of their choice. Many of our trainees stay here at Yale to continue their training in one of our excellent fellowships. Trainees cite the desire for maintaining longitudinal mentoring relationships, continuing research, and expert training as reasons for continuing their training with us. Those who leave match at excellent programs like MSK, Brigham, and MD Anderson, underscoring our national reputation. We know that compensation matters. During your PGY 1 year, you'll receive a starting salary of $86,000. This is 20% above the national mean and highest in the Ivy League cohort. This allows for comfortable living in New Haven's rental market and also still allows for discretionary income. There are many additional benefits that our trainees have access to and readily utilize. Things like free and subsidized gym memberships and 24/7 mental health resources, to name a few. Research in our program is supported through grant opportunities and access to the Yale Pathology Research Histology Lab that is readily accessible for immunohistochemistry and other testing to support research projects. Residents have time to work on these and other scholarly work during their select academic days within a subset of the rotations in our program. Multiple pathology educational resources are provided at no cost to trainees. This includes Expert Path, Path Primer, and Immunoquery. Our program also provides all of our residents with assigned desks and microscopes. Outside the hospital, you'll find New Haven's world-famous pizza, a thriving art scene, East and West Rock parks, quick rail links to New York City and Boston, and beaches that are really just 10 minutes away. So overall, it's a compact and bike-friendly city that has a big city culture and a bit more of a small-town commute. Thank you for applying to our training program. We really look forward to interviewing with you on the interview day. To learn more about our program before your interview, you can visit our residency program website at the QR code below. You can also follow our residents on social media like Instagram and Twitter to learn more about resident life within our program. I look forward to speaking with you on the interview day. Thank you.